everyone, so let's move towards our today's topic, which is
we were talking about borders of ILIUM. What are borders? There are three borders which are present in the ILIUM: anterior border, posterior border, and medial border. Anterior border is on the anterior side, obviously, and it is the side which connects it with the acetabulum. Okay, A for anterior border, A for acetabulum. Anterior border begins from anterior superior iliac spine. Okay, I'm sorry to say, but I forgot something which is very important. In the iliac crest, there are two ends, anterior end and posterior end. I have told you that, but another thing is that anterior end is also known as anterior superior iliac spine, and posterior end is known as posterior superior iliac spine. Okay, so from the anterior iliac superior spine to acetabulum, a line which is going, it is called as anterior border, and from the posterior superior iliac spine to to the posterior border of ischium, a line is going called posterior border. It is very easy, but the difference is in medial border. Medial border is like it is separating iliac fossa from sacropelvic surface. Okay, sacropelvic surface is the smaller surface present on the ilium. It is a rough surface, and it is separated. These two surfaces are separated by medial border. Okay, and it begins from the junction between anterior and posterior part of iliac spine to the iliopubic eminence. What is iliopubic eminence? Iliopubic eminence is an elevation, is a rough elevation of the bone, and which is separating ilium, ilium from the pubis. Okay, ilium and pubis को separate करने में ilial pubis eminence मौजूद होती है उनके दरमियान. Now we will talk about another thing. On the anterior border, below anterior superior iliac spine, an elevation is present on the upper side of the anterior border, and that elevation is called elevation of bone, or noke-like structure, corner-like structure is present. A triangular structure is present, which is called as anterior inferior iliac spine. And on the posterior border, below posterior superior iliac spine, an elevation is present on the bone, on the border, on the upper side of the posterior border, which is called as posterior inferior iliac spine. Okay, obviously on the upper side it is called as superior iliac spine, and on the lower side it is called as inferior iliac spine. And on the anterior border it is called as anterior. If it is on the anterior, it is called as anterior, and if it is present on the posterior border, it is called as posterior. So it's very simple. Now we will talk about surfaces. There are three surfaces: gluteal surface, which is present on the lateral side, and on the posterior side, on the medial side, there are two surfaces: sacropelvic surface, and the large surface which is present on the medial side is called iliac fossa. Okay, now first we will talk about gluteal surface, which is also known as lateral surface. Gluteal surface, on gluteal surface there are three lines. Okay, there are three separation. There are three lines which are forming four compartments, four areas. Okay, one line is called posterior gluteal line. Then another line is called which is present on the middle part of the lateral surface. That line is called anterior gluteal line, and above the acetabulum inferior gluteal line is present. So remember, I've already showed that line in my notes, so you can also see that from there. Now, iliac fossa is on the medial side or posterior side. It is concave area. Sacropelvic surface is behind iliac fossa. It is a rough surface and it consists of three parts: iliac tuberosity, articular surface, and pelvic surface. Pelvic surface is smooth surface. Articular surface is L-shaped structure which is articulating with sacrum. Okay, and together with they are forming a joint called sacroiliac joint, which it is transmitting the weight from axial skeleton to appendicular skeleton. Okay, remember this. Sacroiliac joint is very important in transmitting weight, and iliac tuberosity is the rough surface just below the dorsal side of the iliac crest. So guys, take care of yourself and study hard, work hard, and good luck. Bye.